Hello, everyone. This is Dr. Mike, and you can see I'm here with my best friend, Reese. But I also want to take a moment before this podcast to also give a shout out to Abby Dixson. Abby, how are you doing today?
Dr. Mike, I'm doing great.
Great. Folks, Abby took our very first medical exercise specialist workshop back in 1994. That was when I had hair and it was black. And for some reason, Abby hasn't changed in 29 years. But I wanted to get on and give her her flowers while she could smell them. Folks, I've known Abby Dixon for 29 years. She's a woman of good character. She is a fantastic medical exercise professional and just a good person. I've even gotten to know her family. She supported us in every possible endeavor we've had here at the Medical Exercise Training Institute. And I wanted to take a moment before the podcast just to give her her flowers while she could smell them. Abby, thank you for all that you've done for the profession. Thank you for setting a high bar for professionalism. And just thank you for being a great person and all the support you've given me. I sincerely appreciate it.
Well, it's been a joy and a pleasure, serving under your guidance and all of the expertise that you have freely shared with me over these many decades as I've grown in this profession. Thank you, Dr. Mike.
Well, you certainly have grown, and you've certainly set a standard for us. So, folks, I'm going to ask you to please stay tuned, listen to the podcast. Whatever Abby says, tells you to do, I advise you to do it. Now, you can see she's sitting in a studio. This studio is actually in her home, and she allowed us to reshoot our new medical exercise specialist video training series in her home. And she's built a very viable practice there outside of Washington, D.C. Abby, I even know some of the physicians that are referring clients to you. It came up in a conversation about 2 weeks ago. So she is top notch. She is a stellar professional. She's got a great practice. So folks, please listen in. I know Abby's going to give you contact information after she's done with the podcast. And please, I guarantee you that if you listen to what she tells you to do and you do it, even contact her. She's going to give you pearls of wisdom that will help your practice grow immensely, because she's helped us grow the Medical Exercise Training Institute, grow this profession, and she's helped set a high standard. So, Abby, thank you for all that you've done for us. Thank you all that you've done to support the organization and me, and enjoy the podcast, folks.
Hi, this is Darwin Ruiz, host of the Medical Exercise Specialist podcast, where we talk about the principles, strategies, and guidelines for today's medical exercise professionals. And today we are talking with Abby Dixson. Abby is a certified medical exercise and post-rehab conditioning specialist, health and fitness coach, cancer exercise specialist, Pilates instructor, and a member of IDEA, the Academy of Sports Medicine and Well Coaches. She owns and manages her own facility in Laurel, Maryland, where she helps her clients achieve healthier lifestyles through safe and effective exercise and nutrition strategies. We want to talk a little bit about kind of what you are doing with your practice. You've been a medical exercise specialist for some time now. So tell us a little bit about how you got started with medical exercise.
Well, I became a certified personal trainer in the early 90s. And I've been teaching group fitness for a few years, and was just having clients and students come up to me and ask me about different medical challenges they were having relevant to exercise. Clients with diabetes, clients with specific injuries. And I just felt like I needed to expand my knowledge base so that I would have more confidence and be more capable in helping these clients achieve, better health and take charge of their fitness. And so I actually went to a conference in New York City, which is interestingly enough where I was born and raised, but I lived in the DC metro area at the time. And at this conference, I went to the trade show, and there was someone one of the presenters happened to be Dr. Mike Jones. And he had just started what was then the American Academy of Health and Fitness Rehab. There was a whole lot of names behind the organization at that time when he first established it, before it became the Medical Exercise Training Institute. And it was just great to meet him. And his physical therapy practice at the time was about 20 minutes from where my studio was. So I jumped right on board and signed up for the post-rehab conditioning specialist, as well as was in the first MES course that he presented.
But back then, nobody was really doing medical exercise. Dr. Mike was really the first one to establish this, and back then. So, how many students were there? Was it a large group or was it a small group?
As I remember, and that was a long time ago, I think it was 12 to 15.
Okay, mainly personal trainers.
As far as I can remember, yes.
Okay, okay. And since then, you've you established your own practice really there. And tell us again exactly where you're located.
I'm located in Laurel, Maryland, which is in South Howard County. So I'm 20 minutes south of Baltimore and about 20 minutes north of Washington, D.C.
And when did you decide to sort of establish your own practice as opposed to working for a facility or working for someone else?
Well, there really wasn't any other choice. I had worked at a gym for a short time. I taught group fitness classes, as I still do, for body and soul fitness. But I really wanted to establish my own practice with my own customized way of doing things. So we just finished the basement of the house we were living in. At that time, it was only 500 square feet, but it was wide open space. And I had a treadmill, a recumbent bike, I had a Bowflex, weights, bands, and mats, and the Swiss balls, therapy balls, and just started from there. My first client was a referral from a chiropractor, and she was a diabetic. And I was concerned because I really was not familiar with working with anyone with diabetes. But after I had become certified and learned through Dr. Mike a lot of the protocols working with individuals with diabetes, I felt really able to help this person, and subsequently have worked with many individuals with not only type 2, but type 1 diabetes since that point. So I have maintained a home-based practice. I've since moved 10 years ago, almost 10 years ago, expanded my space, and have a lot of different specialties that I focus on as a medical exercise specialist.
So what we're seeing behind you, that's your facility there, that's in your home.
It's the back of our house, but
Wow.
there's a completely private entrance.
Okay.
And so, individuals who are here, although they pull up into a long driveway, we have enough parking spaces for 10 cars. They would come to the side of the house, private entrance into the area. So the back has all windows looking out onwards, so it's very light and very inviting.
Yeah, just from what I can see, I mean, it looks like a really great space. How did you go about building up your clientele? Was it referrals? Did you reach out to any medical professionals or other professionals in your area? So how did that work for you in terms of getting clients to your practice?
Well, for sure. I started connecting with chiropractors. Sometimes when a client would come to me when they were in physical therapy or about to be discharged from physical therapy, I would ask if I could speak with the physical therapist or go with them to their last appointment when they were going to be discharged, so I could introduce myself to the physical therapist and explain to them that my role was to help pick up where they would leave off, from acute rehab to helping a person with, there are a lot of, as Dr. Mike would say, residual deficits after a person is discharged from physical therapy. So I just started kind of visibly getting involved that way. Sometimes when I would go to appointments with my husband for an appointment, I would give them my card and explain to them what I do. So it was just a slow, gradual process. And then with my group fitness clients or students, as people would have injuries or concerns, that was just a natural way for them to segue into working with me one-on-one.
Okay, so you were still seeing some fitness clients, and then that was one avenue that you might encounter some fitness clients who need medical exercise, and so
yeah, and still do.
Yeah, I see. And so you talked about going to your client's last session with their PT or chiropractor. I think that's kind of a big obstacle for a lot of fitness professionals, is kind of really stepping in and communicating directly with medical professionals. Did you find that they were open to you? Did you have your own kind of reservations around it, or do you feel pretty comfortable with it?
Initially, I was a little nervous, but I found that I still am working with someone who had cervical fusion, and she had been a PT client, a personal training client. But after she had that surgery, she wanted me to go with her to her orthopedist for her follow-up appointment. And I went with her, and he was delighted that I was going to be helping her regain mobility, flexibility, and strength. And I went over some of the protocols that I thought would be useful for her, and he was, all thumbs up, and it just really encouraged me. It really did encourage me. So I continue to do that. I continue to write letters to clients, physicians, recently clients, rheumatologists, and concerned about some autoimmune challenges she's having. I wrote a letter to him saying that this client had been coming to me for medical exercise programs, and this is what we have been doing. And she reported to me last week that he was thrilled that she was coming to me. So that's kind of how you build credibility. I recently met a medical doctor. She's an ER doctor at a local hospital, and has just recently opened up a weight loss clinic in my area. And I met her at a business women's network, kind of a luncheon networking thing. And she was so interested in I handed her my card, and she reached out to me, and she came to my studio, and she said, I have never heard of medical exercise as an actual practice. She said, we usually just refer our patients to PT, and that's the end of it. So she, it's just building those relationships and getting out there, is very important.
Did you do any other forms of, let's say, advertising or anything, or was it just a lot of networking, kind of in person?
I have a website, business cards. All of us who've been in this industry, we do health fairs many times. Sometimes it just feels like a long day of just passing out cards or doing little demonstrations. But it oftentimes will yield back a client. I feel like I'm on different websites. I'm also a cancer exercise specialist with CD, Cancer Exercise Training Institute, that Dr. Mike mentioned to me many years ago, as I have been over the years experiencing more and more clients who have either been through cancer treatment or going through cancer treatment. So being on different websites helps to get referrals.
Does your practice, as of right now, do you tend to specialize in any areas, or do you kind of work with a lot of different conditions?
Well, I work with a lot of different conditions. I do specialize in oncology and diabetes, osteoporosis, individuals with autoimmune conditions such as fibromyalgia, rheumatoid arthritis. I've worked with clients who have lupus, and many who are struggling with just overall deconditioning. I, in the last 2 years, have had at least 4 or 5 clients who have had hip replacement, knee replacement, shoulder replacement. And so these baby boomers should be a steady stream of clients over time, because our population is aging. But many people who have these conditions, who have joint replacement, want to stay active, want to be engaged with their grandkids, go golfing and play tennis. Pickleball is the big thing right now. So I am really excited to help them get back into mobility and strength and full function. So it does cover a vast variety of conditions.
And, there's a lot of, I think, fitness professionals out there who are either making the transition to medical exercise, or maybe they're just considering medical exercise. Is there any, somebody starting out, let's say building a practice, what kind of advice would you give to someone having been doing this for many years, but also now having built up your own practice, maybe some of the things that you wish you would have known when you were starting. So what advice would you give?
I would say start one client at a time. Create a good business brochure describing what medical exercise is. Sometimes you have to make some cold calls to local doctors, drop off your flyer. Rack cards are great. And just getting that exposure. But the other thing I would say is really learn and study and understand so that you feel confident and capable to help a person who comes to you. None of us have all the answers, but I think it really helps, especially a new client, to understand that you understand all the medications that they're on and how they interact with each other and how they may affect a person's heart rate or their ability to function. If they're on prednisone, for example, because they have an autoimmune condition, there's certain things that you need to be concerned about with them and certain types of exercises because they may bruise easily if they're on prednisone. So it's just that knowledge base really helps a client feel confident with the person that they're working with. So that's what I would encourage in MES.
I think people need to realize that it's not, I think in personal training, it's very much you train for an hour and then that's it. But with a medical exercise client, you really have to take some time outside of this session to, like you said, really understand what medications they're using, really understand the condition. Any activities are contraindicated, things they shouldn't be doing. So yeah, I think that's an important point to raise. And I think a lot of people don't always think about that. And you made another good point too about really explaining what medical exercise is, because I think, like the one person you said who they said, I didn't even know what medical exercise is. I didn't know it was a thing. And so I think there is some lack of awareness among the public. Also, maybe there's a little confusion. I know sometimes some people think it's like physical therapy, but it's actually not. So yeah, I think for new MESs and anyone looking to get into it, I think understanding that they really need to take the steps to educate not just the public and their clients, but maybe even some medical professionals. You might have to explain to a doctor kind of what your role is and what your scope is. But have you ever had any, have you encountered that, any sort of confusion around what you do when you're talking to medical professionals? Or are they just kind of open to just learning about it?
Because I am a personal trainer, I think at times doctors are confused. They just view you as a fitness professional. So clarification is very important. I say having printed information, having a website that explains what corrective exercise is and the benefits of having a medical exercise trainer or specialist is, as opposed to someone just being discharged and sent back to a gym. I've had a few clients over the years post-surgery, their doctor say, go back to what you were doing before you're clear. And it was a disaster. And then they came to me after they got a hernia from doing deadlifts after having major cancer surgery or any type of normal surgery without having any kind of guidance or supervision. So I think it's really important that the client understand too that they have to explain to their doctor that they need a little more than just exercise. They need medically supervised exercise programs.
Yeah, because in many cases they might go to a personal trainer, and so in a sense they are supervised, but that trainer may not have the training or the awareness of what to do in terms of developing a program for that client. As far as how your clients, in terms of your work with clients, and one of the things Dr. Mike talks about is that in the future, more and more insurance providers may be covering the cost of services like medical exercise. Are all of your clients or any of them working through insurance in terms of the payment, or is it just direct towards you?
It's direct, and so I will provide an invoice and they're, with the treatment code, but it's very individual based on their insurance. and what type of diagnosis code their doctor provides them with.
You don't deal with any insurance companies, but you just provide the information that they need. Okay. And kind of looking ahead, one of the things that we like to talk about is really kind of where this profession is going. It's certainly, the need is going to be growing. But what do you see kind of as the future of medical exercise, not just with your own practice, but really kind of just medical exercise in general?
I think especially the baby boomers, and we are a vast group of individuals population, as the population is aging and living longer and want to have a higher quality of life and remain active, that the role of medical exercise has become more prominent in the mainstream. And I would like to see it become status quo as far as doctors, realizing that a person may not need like physical therapy because their blood pressure is high, their A1C is climbing. They really need to see someone who is capable and trained to help that person managing these conditions through exercise in a safe and effective environment.
Well, tell us kind of, if somebody wants to learn more about you and what you do, maybe a little about your practice, tell us what your website is.
So my website is Medifit, MEDIFIT, now.com.
And if anyone has any questions and maybe wants to reach out to you,
they can reach out to me at abby@medifitnow.com, or they can reach out to me. My other contact is on the website.
Okay, great. And again, that's www.medifitnow.com, MEDIFITNOW.com. Abby, thanks so much for taking the time to speak with us and talking a little bit about your practice and what you do. Anything else that you want to share with anyone who's listening, anyone who's an MES right now or looking to get into MES?
Just take one step at a time. Find your niche, find what you feel is your specialty. And it could be several things, but be the best at what you do. And it will definitely be the most rewarding thing you've done. And I can say after almost 30 years that I am so thankful that I met Dr. Mike. He has been such an incredible encourager over the many years to be able to reach out to him with questions and concerns. He's always been like the best cheerleader I've ever had. He's come to my studio. He's just been a great support and inspiration. And I consider him my mentor. And so thank you, Dr. Mike.
Yeah, likewise. I think I consider him a mentor as well. He's been I've always told him makes himself very accessible to us. And he's available for questions, and he's always been very helpful and very supportive in our work in medical exercise. So thanks to Dr. Mike, if he's listening. Anyways, thank you, Abby, again. And we look forward to talking to you again in the future. Again, if you want to learn more about Abby, visit our website at www.medifitnow.com. Abby, I hope you have a great day, and we will talk to you soon. And for everyone listening, we'll see you in the next episode. Thanks for listening. Thanks again for listening. You can find other episodes of this podcast at www.medicalexercisespecialist.com. That's medicalexercisespecialist.com. Also, if you are a current medical exercise professional or you are thinking of becoming one, join our MedX Pro community, where you can connect with other medical exercise professionals. You can get additional resources to help you build and grow your practice and help your clients better manage their medical conditions through exercise. Visit www.medxpronetwork.com. That's MED, the letter X, PRO network.com.